Welcome to the Deep Dive, where we try to cut through the noise and get straight to the insights.
Glad to be here.
Today we're diving into the often confusing world of health claims.
Mm-hmm.
And we're using Coenzyme Q10, or Q10, as our main focus.
Right.
This whole deep dive was actually sparked by a really thoughtful question from one of our listeners, Vincent Tsai. He asked Professor Lin about Q10, its effectiveness, potential interactions with anticoagulant meds, things like that, and also about other common advice like garlic and ginger.
Exactly. So our mission today really is to dissect the evidence. We want to separate, clear scientific fact from some of the more popular, maybe unsubstantiated claims out there. And we'll use Professor Lin's careful insights as our guide, hopefully helping you understand the science or sometimes the lack of science behind health info.
Right.
We'll cover two main areas: those interactions with anticoagulants, and then the broader claims about Q10 supplements for heart health.
Okay, sounds good. So let's unpack that first concern from Vincent's, the anticoagulant interactions, specifically with warfarin. What does Professor Lin's research actually tell us about how things like garlic, ginger, or even Q10 might interact with these, vital medications?
Yeah, this is really important. The evidence here is actually quite clear, and it's a critical safety thing.
Okay.
Many reputable medical sources, and Professor Lin highlights this, do issue warnings about substances like, garlic, ginger, ginkgo, ginseng, saying they can interact with warfarin. And what's particularly important here is that there was one focusing specifically on CoQ10 and ginkgo biloba. They've also shown interactions that can affect warfarin dosage.
So it's not just a theoretical risk.
No, not at all. So for anyone on anticoagulants, this isn't some myth to ignore. It's a serious, evidence-based concern. It definitely needs caution and a conversation with your doctor.
Right. Caution and consultation, absolutely key there for anyone on those meds. Okay, so now let's pivot to Q10 itself. Vincent mentioned an article he saw, I think from Hello Doctor, that was promoting Q10 for cardiovascular health. It said, our bodies make it's in fish and meat, but production goes down as we age. And this is the bit I wanted to ask about, suggested a daily recommended intake of 30 milligrams from supplements.
Yes, the recommended daily dosage.
What do we make of that? Is that a real thing?
Okay, here's the critical takeaway on that specific number. That 30 milligram daily recommended intake for Q10. It's basically a myth.
Really?
Yeah. As Professor Lin really emphasizes, no major medical institution, no significant academic research body has ever made such a recommendation. So yes, Q10 is vital. Yes, we make it naturally. Yes, it's in food. But this idea of a specific daily recommended dosage for supplements, that's a popular claim that, frankly, needs debunking.
So it's just kind of floated out there without strong backing.
Pretty much. It's a prime example of why we need critical thinking when we encounter health information online or, anywhere.
Okay, so that specific recommended dose is out. But what about the bigger picture claims? Does Professor Lin's analysis find solid evidence that Q10 supplements can actually, say, prevent heart disease or really improve heart failure outcomes?
Well, the scientific support for those kind of grand claims is actually quite weak, often inconclusive.
Weaker than you'd think from the marketing, perhaps.
Definitely. Professor Lin points out that, like a lot of supplements, Q10 has been sort of overhyped. You look at the National Center for Complementary and Integrative Health, the NCCIH.
Right.
They note only a few studies have even looked at Q10 for preventing heart disease, and the results just aren't definitive. There's also no strong research supporting its general use for heart failure either.
Okay.
And actually, there was this intriguing paradox noted in a 2019 paper, the paradox of coenzyme Q10 in aging.
Oh, what was the paradox?
It observed that animals that were unable to synthesize Q10 naturally actually lived longer. Without making Q10, that seems completely counterintuitive.
It does, doesn't it? It certainly adds complexity to the story about how Q10 works in the body versus supplementation.
Wow. Okay, so building on that kind of evolving understanding, what has the most recent data shown? Anything new on Q10 use and, say, mortality?
Yes, there was a significant study in 2024, a population-based cohort study, which Professor Lin referenced. It looked really closely at Q10 supplement use in the U.S. over a long period.
And what did it find?
Well, first, it confirmed that Q10 use went up significantly between 1999 and 2018. People are definitely taking it more.
Okay, no surprise there.
But the main conclusion was that Q10 supplement use was not associated with overall mortality or cardiovascular disease mortality. No benefit seen there.
So no link to living longer or avoiding heart-related death overall.
Exactly. But here's the most startling finding, really. For one specific subgroup, participants who were obese taking Q10 supplements was actually linked to higher all-cause mortality.
Higher. Not lower, but higher. Higher, yes. It directly challenges that idea of a universal benefit and, frankly, really underscores the need for evidence-based decisions, not just jumping on a supplement trend.
That is, yeah, it's genuinely surprising and concerning. Okay, so bringing all these insights from Professor Lin together, what's the core message we should take away here?
I think it means we just have to be really discerning consumers of health information. It's true, Q10 is vital. It's widely available in foods. Our bodies make it. But you should be highly skeptical of claims that you need supplements to significantly boost your levels, or especially that taking them will prevent heart disease.
Got it.
Professor Lin's careful approach really reminds us to distinguish between what's scientifically supported, like, yeah, Q10 is naturally in food, and what's not.
Which includes the idea that most healthy people need supplements.
Exactly, or that it offers broad cardiovascular benefits across the board, especially given the, well, that quite concerning finding about higher mortality in obese individuals from the 2024 study.
Right. So for you listening, what's the key takeaway from this deep dive? I suppose the challenge is the next time you come across a health claim or maybe a miracle supplement, what critical questions will you ask? And what kind of, robust evidence will you look for before you really take it to heart?